This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh and we're near the oncology department. Now it's unfortunate, but people are diagnosed with cancer just about every day, and news of that diagnosis can be overwhelming to people. And that's why Aurora's put together a great team to help families and patients deal with that devastating news. And we're going to start our interviews with Nell Diamond. She is a nurse navigator here at Aurora Cancer Care Services. And a nurse navigator, that's a term I haven't heard before. What is your role here?
As a cancer nurse navigator, I am here for patients and families, particularly a patient who is newly diagnosed with a cancer. I am meeting with them shortly after they meet with a medical oncologist. At the time I receive them or I'm meeting them, they have been given choices by the medical oncologist on what their cancer plan will be. My role is acting as a support agent for them and really supporting them during a very devastating, difficult time.
Right, and I would imagine it's not only for the patient, but for the family as well.
It is for the family as well. We truly look for family as supporting them just as though we in the medical field are supporting. We ask family to really support them in their choices and to be there for them and to act actually as their advocate too. So if they're having difficulties at home, that not only the patient should be calling, but the family can also call us.
Yeah, and now I would imagine this is not just a one-time meeting with the family and the patient.
It is not. I meet with the patient and or family together initially. I meet with them in between. It really depends on how the patient is doing. If they're struggling, having difficulties, I will intervene and take care of them.
Mm-hmm. Now I understand you have a multidisciplinary cancer clinic. What does that mean?
The multidisciplinary clinic is where we have a patient come in and they're meeting with many providers. It is not just the one provider, so it's not just the surgeon. They will see the same day the surgeon, they'll see a medical oncologist, they will see a radiation oncologist, and depending on whether it's breast or prostate, we'll bring in those other services.
Yeah,
so
that's going to be a
it's
huge benefit to
right.
the patient. Instead of having to book interviews day after day, you're getting it all done in one day.
Exactly, and we also bring at that time, we potentially could have a genetic counselor seeing them as well. The purpose really of the multidisciplinary clinic is that the patient is not having to come in to see 5 different physicians or providers. They're seeing them on the same day. It maybe will take a 3-hour or 4-hour chunk out of their time, but the surveys results are that they really appreciate seeing all the providers, getting all the input from each of those, and to come up with what that plan will be.
Yeah. Now, I would imagine you have an extremely emotional job working with these families that are just starting to deal with cancer. What is the number one thing that you try to tell families when they're first beginning this process?
I really like to relay to them that they're not alone in the journey, that I am here for them always. I think sometimes patients are a little bit afraid to call the doctor, perhaps with an emotional problem, whether they're not coping well, they're crying, they're not sleeping. They can call me. And I work particularly very well with other providers at Aurora. I certainly have the presence of our medical oncologist here, but sometimes they just need to talk, and I'm here for them. They're never going to walk the journey alone. And what I ask for them is to really be open and honest. I can make referrals to psychologists that we use, and that is through the behavioral health program, and it's great. They need to be thinking that they're making the right medical decision and the choice. They need to have great faith in their provider, and it all comes with the support of the family and knowing that they're confident in their plan of care. They'll get through it.
That's great information. Thank you for joining us today, Nell.
You're welcome. My pleasure.
We're now joined by Jessica Bozovic, and she is an oncology social worker. So we just talked to Nell a little bit. How is your role different from what Nell is doing?
Well, my role is really a component of Nell's. I'm more the non-medical part of Nell. I help and I meet with patients along the same time Nell does, early in diagnosis. Help them, this is a new diagnosis, so a lot of unknowns come up for patients, and they have questions and concerns that I try to help them with.
Yeah, I would imagine your life, your lifestyle, job, family things change a lot once you're diagnosed with cancer.
Absolutely. A lot of patients, obviously, their world is turned upside down, and we have my position here as an extra resource person for patients, just to maybe take a little bit of a load off of them. So if they have questions about how to take time off of work or some of the more practical matters like that with their life and treatment, I'm here to help navigate that part for them.
Sure, and I would imagine one of the biggest things the family and the patient's worried about may be a financial situation as well.
Absolutely. We always tell patients, you get a cancer diagnosis, your expenses go up, but your income never does. So I'm really here to help support, that aspect of it, whether it's finding grants, working with different organizations, or even helping them come up with a payment plan. It really all goes hand in hand, and just try to relieve some of the stress that comes along with this diagnosis.
Yeah, it's quite a team you guys have here to help the patients. Yeah. Well, thank you for taking some time with us today.
Thank you. You're welcome.
Now, if you have any questions regarding the Aurora Cancer Care Services, or you're seeking a second opinion on your diagnosis, you can always call Aurora at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.